If people were at any of the exposure locations listed above and have not been contacted, we're asking people to please call North Carolina Public Health Outreach Team at 844-628-7223, and they will be provided further guidance. So really some key takeaways is anyone who develops symptoms of measles should contact their primary care provider immediately and limit any contact with others, as well as making sure that you call ahead before you visit any healthcare provider or emergency department so we can really help to prevent additional exposures. And then, of course, everyone should make sure that they're up to date on all of their vaccines, but especially making sure that you know your immunity status to measles. Happy to take any questions.
Hi, this is Helen from Blue Ridge Public Radio. Uh, Do you have the date when this person was diagnosed? Because it seems like they went to they were at different health settings. So do you have a date of diagnosis of this case?
We're not going to be releasing any more specific information to protect that individual's privacy.
Gotcha. Any other information around the second person who is not, can you say what county or any identifying location of the person who came through with that was positive for measles and may have exposed others? Any age or any other information?
I am not aware of any other information, just that that person is not a resident of Buncombe County.
Gotcha.
Sorry if someone asked this already, but is the person that is involved in this news case in Buncombe County, do they work in healthcare?
I'm sorry, I'm having a hard time hearing you
Are you able to hear me a little bit better? No,
a little bit.
a little bit. Sorry. Okay. I was just asking with this news case in Buncombe County, do they work in healthcare?
Once again, we're not going to be providing any specific information about that case to protect the individual's identity.
It's me again. Helen, is anything else you want people to know? I know you've been giving the message repeatedly. Please do not show up at the at a healthcare provider or emergency department, but anything you want to share or sort of what happens. I know you've been on guard the whole time, although we've been holding steady at 6. So just kind of does this change things or what's happening on your end?
Yeah, so once again, I am strongly encouraging everyone, like if you haven't yet, now is absolutely the time to make sure you know your immunity status. And if you need to get an MMR vaccine, the measles, mumps, rubella vaccine, now is the time. We have plenty of vaccine available at our clinic here at 40 Cox Avenue. Um, if people don't have a way to pay, we can get that vaccine for people for free. So there should not be any out of pocket cost for people. So I encourage everyone to please come and get a vaccine if needed. You can call our immunization clinic at 828-250-5096 and schedule an appointment if that's easier for you than walking in. But you can also walk into our clinic and access that vaccine Monday through Friday, 8 to 5 p.m. And once again, I do think it's important to really stress if you're having symptoms, and the symptoms of measles can be very similar to many of the respiratory viruses that we see during this time of year. So it's important to err on the side of caution. If you're sick, please stay home. Contact your doctor, call before you go to any healthcare location, because it's really important that we limit the exposures, knowing how infectious measles can be. We can see, of course, right across the state line in South Carolina, there are still just many, many cases. So measles can spread like wildfire. And unfortunately, when we have these pockets of unvaccinated people, the virus can really take hold and spread very quickly. So we need to be very proactive now.
Okay, are there any additional questions? Okay, not hearing any. Thank you, Ellis, for your time, and thanks to our media partners for helping us to provide this information to the community. I do not have, depending on what happens over the next couple of days, we will, just be flexible. And if you see a notice coming your way about media availability, you might want to tune in because that might mean that we have some new information to share with you. But thanks for joining us today.
Thank
Thank you so
you.
much.